Hi there, today we'll be talking about supracondylar fractures. This is probably the second most common fracture in children. If your child has had a fall and now has pain and swelling or difficulty moving their elbow, they might be having a common injury known as a supracondylar fracture. What is a supracondylar fracture? A supracondylar fracture is a break in the bone just above the elbow, specifically in the lower end of the humerus, which is the upper arm. This is one of the most common types of elbow injuries in children, particularly around the ages of 5 to 8. What causes supracondylar fractures? Most of the time, the injury happens when a child falls on an outstretched hand. So with the arm straight, like falling from a swing or from a bed or a bike while they're running. Because children's bones are still growing and they're softer than those of adults, this area near the elbow is a common weak spot. What are the common symptoms of supracondylar fractures? So right after a fall, you might notice a few of these things. They could have severe pain around the elbow. They may have swelling and bruising. The child may hold their arm still, not wanting to move, especially not wanting to move the elbow joint. The elbow might look a bit bent or just mishappen. In very severe cases, there may also be things like numbness or tingling in the fingers, or the fingers may appear pale or feel very cool. These are signs that the blood flow or nerves might have been affected, and this is an emergency. How do we investigate for supracondylar fractures? How do we confirm there's a supracondylar fracture? When a child comes to the clinic or the hospital with an elbow injury, here's what we usually do. One, we need to examine the arm carefully. We need to check for swelling, check for deformity, rule out any injury to the nerve or the blood vessels. We need to check their pulses, right? Look at the fingers. Are they moving like they should? We need to be sure that the hand is well perfused and the nerves are working. Then we go on to take x-rays. So this confirms the fracture and it shows us how displaced it is, like how out of line it is. And it helps us plan the treatment. Sometimes we need an x-ray for both arms to compare with the uninjured side, especially if the fracture hasn't moved so far out of place and we can't really know, especially if the fracture hasn't moved out of place. How is it treated? How do we treat supracondylar fractures? The treatment depends on how displaced or how out of place the fracture is. So if the bone is not displaced, the child may just need to be put in an above elbow cast for a couple of weeks and then they'll be fine. If the bone is displaced or unstable, your child will likely need a short surgery and a general anesthesia. During the surgery, the bones are realigned the way they should and they're held in place with small pins. The arm is then placed in a plaster or in a cast for healing. The pins are usually removed at about 3 to 6 weeks. Pins are typically removed in the outpatient setting. What's the recovery process like for following supracondylar fractures? After the surgery, the child will sometimes be admitted for a day or two just to observe how they're doing, make sure there aren't any other complications following the intervention. When they're admitted, we'll sometimes get an x-ray after the surgery to confirm that the placement of the pins is right and the fracture hasn't moved out of that position even after they came out of surgery. When they're well and pain is well controlled and everything is good, we send them home. While they're at home, we advise that they don't wet the cast. We don't allow them to do sports, particularly things that require running or anything that will actually get them to fall down again and re-injure themselves. All these are contraindicated during this time. Sometimes they'll be in a sling for comfort. Many children don't like it, and that's okay. And then we'll tell them the date to come back to have the cast and the pins removed. When they do come back, we'll typically get an x-ray to see if the bones are healed well and the pins will be removed. And then we'll get them to start moving their arm, which we call active range of motion of the elbow, to try and regain that range of motion. Sometimes they could be a bit stiff following removal of the cast. This is expected. And I know parents do freak out and they're wondering, the arm was moving well before the injury, why is it in this position now? It's a matter of reassuring that they've been in a cast for nearly, 4 weeks. So the muscles have contracted some. And so as they get back to normal function and moving their elbow, their arm should go back in full motion in no time. The other thing is that sometimes the arm might heal with a bit of a bend. So this is dependent on how well the arm was reduced during the surgery. But sometimes it also could depend on the fact that the bone moved slightly out of position during the recovery time, during the recovery period. So this is why we keep a close eye, just to make sure that any of these things that are encountered are treated adequately, or we continue with the observation to make sure that they don't progress further. Now let's talk about the prognosis of supracondylar fractures. Most children recover fully from supracondylar fractures if they get the right care. The bones usually heal well. Most kids regain full movement and strength. And long-term problems are extremely rare, but early treatment is very important. But that said, if the injury is not treated properly, or if there is nerve or blood vessel damage, complications like elbow stiffness, deformity, and nerve issues can happen. What can parents do? It's important for the parents to seek care immediately after the elbow injury, especially if the child is in pain, and can't move the arm. Watch for warning signs. These are things like severe pain that's unresponsive to adequate pain medication, if the fingers are cold, if they have lost sensation, if there's extreme swelling. Follow up as advised for cast checks, pin removals, or for assessment of range of motion. Some stiffness is going to happen, especially immediately following removal of the cast. It is normal, and this improves over time. So a quick recap on supracondylar fractures. A supracondylar fracture is a common elbow injury in children. It often happens from a fall on an outstretched hand. The symptoms include pain, swelling, and limited motion. Diagnosis is typically gotten by doing a clinical examination and getting an X-ray. Treatment typically depends on the severity of the displacement. It could be with a cast or with surgery requiring pins and a cast, but most children make a full recovery. So thank you so much for watching this. If your child is facing this injury, remember, you've got this. And with the right care, your child will bounce back stronger than ever. If you found this video helpful, give it a thumbs up. Don't forget to subscribe and share it with other parents. And until next time, stay safe and keep it on little growing bones.